Good evening, Malden. I'm Gary Christenson, Mayor of the city, and we are back with another update regarding COVID-19. As always, I want to begin by thanking Malden Access Television, soon to be known as UMA, for working with the community to bring you these updates. I also want to thank our panel in advance. You know them by now. We have our Director of the Health Department, Chris Webb. We also have the Chairperson of the Board of Health, Dr. Kourtney Nickerson. And then finally, we have our Business Development Officer, Kevin Duffy. And this is all made possible by our Communications Director, Ron Cochran, who will help us administer tonight's broadcast. Now, the reason we wanted to do one this week is there's a lot to unpack from what was communicated to us on Monday by Governor Baker. So each of the panelists not only have the latest data, but they also have now analyzed all of the orders that came down from the state, and we want to talk to you about those tonight. So as we typically do, let's get some introductory statements from our panelists, and then we want to turn it over to you to answer as many questions as we can. So let's start first with Chris Webb, Director of the Health Department.
Hello, Mr. Mayor. Hello, everybody. It's great to be back again. I really wish that we could have these conversations about something other than this virus, but we've got some upticks lately in our testing and a positivity rate. And I think the governor's recent, what I would only characterize as rollback, I think are a good step in the right direction. I hope to talk more about that with you this evening.
All right, and then Chris, before we forget, how do people get a hold of you if they don't have their questions answered tonight?
I can be called, my office number is 781-397-7049, or you can email me at cwebb, W-E-B-B, at cityofmalden.org.
Okay, great. Thank you. Dr. Nickerson.
Hey, Malden. Thank you for having me back tonight. Thank you, Mayor. It's sad to be back because we're still in the middle of this pandemic, but I want to commend everybody for their efforts. I know that you've heard the new regulations. They're strict. It's taken us back to a little bit of April, but just remember we have more information now. We know more about what we're doing and the impact it has on ourselves and others. And we are in control of a lot of things. So, and one other resource I want to point out tonight too is the mental health resource links that we have on the Department of Public Health part of the Malden website. So if you are in need of those, please reach out and take advantage.
Okay, and Dr. Nickerson, if people had questions and they wanted to reach you after the show, how would they do that?
Probably the easiest way would be to go through Chris, and he can send anything on to me.
All right, very good. All right, Mr. Duffy.
My apologies, I've been having difficulties with my mouse, so thank you for the opportunity. The businesses in the city they initially breathed a sigh of relief when they got the new orders from the governor, but then once they realized it wasn't as bad as they had thought, it settled in that this was a further restriction on their hours. So there is concern that, you know, their life is slowly being squeezed out of them, but it's a fine balancing act between protecting the public and keeping businesses going. So hopefully we can figure out a cure to COVID sometime soon and businesses can get back to what they do best, which is making money.
Okay, very good. So let me just ask one question of each of you before we turn it over to the public. So back to you, Kevin. We ended with you. Let me ask you the first question. So when you said the restaurants or the businesses had a sigh of relief, how bad could it have been?
Well, I believe their fear was that it could be as bad as indoor dining has stopped again, so that they wouldn't be allowed to serve and they'd have to go back to what it was like in April. And then there was always the outside concern that, you know, everyone's afraid that perhaps we go to a full-on lockdown.
Okay.
So when they heard that the hours have been reduced and the size of the indoor gathering had been shrunk, they were relieved that they were still able to do business. But then as they really let that soak in, they realized, hey, we're cutting out a significant portion of our earnings by cutting off the end of the day, especially on Thursday, Friday, and Saturdays.
So Kevin, anybody watching, when do these new regulations take effect?
They are in effect. I believe they went in on Friday, but Chris can confirm that. Actually, I believe tomorrow, Friday coming up. the 6th.
Friday coming up. Okay.
Correct, sorry.
And Kev, what are some of the rules for someone who frequents the restaurant scene? What are the rules that'll take effect Friday?
So patrons need to be leaving the restaurant by 9:30 so that they're home in time for the 10 o'clock curfew. So you should not be getting sat at a table for a fresh meal. I would say anytime after 9 o'clock. Even 9 o'clock is going to cut it close. If you see restaurants that are having people come in at 9:15, that's another signal to me. We talked about it last week that the restaurant isn't taking it seriously. And that in that case, I would get up and leave, because if I can see that, what else are they not doing?
And they should let us know, right?
Correct.
Yeah.
Absolutely.
And now, Kev, after 9:30, people can still order takeout?
They can come in for takeout, but there's no hanging around. You can't sit at the bar and have a drink. You definitely can't have food. So if you ordered food, you can come in and get it and get out, but they don't want people hanging around and gathering. They want people headed
Okay.
home at 9:30.
Final question, Kevin. What's been the change on the indoor aspect?
It's down to parties of 10. So your table size is no larger than 10. And when you have gatherings, it's 10 as well on the inside. So if you're having like a baby shower or something like that and had a private room, it had gotten up to, I believe, and Chris can correct me on this, 25 at one point. It's back down to 10 now.
Okay, very good. All right, thank you, Kevin. Let's go to Dr. Nickerson. So in one of our recent calls with other mayors, I asked the doctor that was on, what makes this different from March and April? And he seemed to think that it was the small gatherings that were the culprit. Do you agree?
I do agree. I think that's what the data is showing us, that it's people are getting comfortable. We're meeting in closed contact space, and that's what's encouraging transmission. So what is different from April is that we understand a little bit more about how the virus is spread. And we know that those are the conditions under which we're promoting spread. So, and we know that a lot of people aren't showing symptoms when they might be the most contagious. So we've got a lot of variables against us, but also variables that we can control. We know that we can avoid small group gatherings in homes. As the weather gets colder, it becomes harder, because we want to see our friends, people. We are a social species. So seeing those people is important. So I would agree with that. Absolutely.
Okay, very good. And then finally, Chris, we get asked this all the time when the numbers go up. Is it attributable to any clusters that you know of in the city, or is this still symptomatic of, what you have said in the past, that, people going back to work, people going back to school, we're home to a lot of working class families? What do you think?
I think that's all of it. The life has gotten back to normal for a lot of people, maybe a little too normal, but because it's hard to, if in an ideal world, you'd have a family with 5 and maybe of 3 of the kids, there's 3 kids, only one of them that participates in athletics, so you don't have as much confluence of people, but it would never work, right? We tried to do that in society. It would never work. It definitely wouldn't work in a family. It's just, that's what's bringing it on. Young people going to work and socializing. We can't ignore that. And the next age group, 20 to 39, is where the real jump is. And that's a lot of working age people and people with multiple jobs as well. So their resistance is a little lower. I don't want to say everyone's a partier, but going to parties for, I've heard of baby showers, wedding showers, churches now are being suspect. So the virility of the virus is back. It's not any less virile than it was before, and it's not probably any more virile. It's just that we're getting closer together as the season's predicted. And we all need to just keep to the basics. Again, mask all the time, wash your hands, and please sanitize touch surfaces. You don't hear that enough, and I don't think people do enough of that. That can help a lot.
Yeah, and that age bracket that you just described is exactly what Governor Baker said on our last call, which was nearly 40% of the new cases are coming from that age bracket. 20, I thought it was 20 to 50 or 40.
So that's a combination. Actually, it's 20 to 59. That would be 2 age ranges together. They're right in the middle of the graph. They're considerable numbers.
Okay. All right, let's hear from the community. So, Ron, where are you going first? YouTube, or do you have a caller?
Well, actually, neither. I always like to give a quick overview of how you can get in touch with us. As always, we're monitoring a lot of different channels. We are looking at our Facebook page, facebook.com/City of Malden for questions. We are looking at YouTube for questions. Of course, if you're old school and you like the call-in technique, we have that available. There's folks at Malden Access Television Studios ready to field your calls at 781-388-9394. And if you want to watch the show, you can do so on, well, hopefully you're watching it already, but there's a couple of different ways you can watch it. And that is on MATV's YouTube channel, as well as Comcast Channel 22 or Verizon Channel 26. Before we get started, if I might, Mayor Christenson, I'd like to point out, it didn't come out so good in my Zoom background, but I do want to say it's the 2020 Veterans Day poster that was given to me by Veteran Services Director Kevin Jarvis. It's not coming through nice, but it does say honoring those who served. And I want to use this as a time to plug, if you are a resident who is either a family member or you yourself have served or currently serving in the armed forces, we're doing a very special, in lieu of a parade, we're doing a very special video, sort of combining video messages from folks that we receive these messages from into kind of like a virtual parade. So if this is something that's interesting to you, please do reach out to me within the next day or so, because we're trying to lock down all the messages now. At my email, which is rcochran@cityofmalden.org. That's RCOCHRAN@cityofmalden.org. And I will make arrangements with you on how to get you added to this video. So I did want to mention that. And we will be debuting that video, next week. So if you want to be a part of it, please do so. Please reach out.
All right, thank you for that, Ron.
Yeah, no problem. Our first question, I think Kevin covered it a bit, but I think it bears some elaboration on this one. And that is, I think there was a lot of confusion over capacity, right? So we always talk about this in restaurants. It's not about capacity. It's about, as you point out, percentage of. So maybe if you could get into that, because I think that with the numbers going down, meaning the amount of people that are allowed to gather, I think restaurants were called into question. And so maybe if you could elaborate on that.
Okay, Kevin?
Sorry, again, my mouse.
No worries.
So my understanding is that it's not an occupancy level, a percentage or anything. It's basically when a restaurant goes in and sets up their tables so that they're appropriately social distance, whatever they can fit in there, that is their occupancy now. So it's not a 40% or a 50% of their occupancy. It's what can be fit in there. In terms of having an event, an indoor event, that's the number that's been reduced to an actual number of 10 people, no more than that. So that's the requirement as I understood it. Chris?
So Kevin, before we go to Chris, let's use the bistro as an example. So you have the rooms in the back for events, small events. That has a hard cap, you're saying, of what?
Correct.
What is that cap?
10 people.
As of
So-
Friday.
As of Friday. So they were able to do, like Chris had said, baby showers and stuff up to 25. Obviously, the numbers were going the wrong way. They were identifying these small group gatherings. So they just reduced the size. So you
And
can
what
still
time does
do
that,
it.
what time does that take effect Friday, Kevin?
It would be, I believe, Friday morning, as soon as the 6th rolls around.
Okay. And then out front, it isn't a percentage. You're saying you could still have as many as they can fit in socially.
With the proper social distancing, right?
Yeah.
Because that is not considered an indoor event. That is just indoor dining. So as long as your table's appropriately spaced, the back of one chair is 6 feet from the back of another
All right, let's
chair at
check
a
your,
different table. That kind of eliminates a lot of the occupancy.
all right, let's check your analysis. Chris?
He's absolutely right. He's
Okay.
hit the nail on the head. Good job, Kevin.
Okay, all right.
You have to understand though, the one variable that's different now is that we're closing earlier. So your exposure times get reduced and people consume more alcohol later in the day. So they get a little more boisterous where there are liquor licenses, right? So that's really kind of what they're trying to cut down on. The familiar, where people get a little more familiar later in the evening, I guess. And, there wouldn't be so much standing up and mixing between tables. So that a lot of that is speaking to that 59 age group.
Okay, and Dr. Nickerson, I was asking our Chief of Staff, Maria Luis, why do you think they settled on 9:30? Why not 9? Why not 10? Why
I
not
think probably
Thursday,
just,
Friday, Saturday? Why not limit it to those? I mean, what do you think?
I think just for the reasons Chris started to mention is, once we get later into the night, we start to make less smart decisions maybe.
Yeah.
Don't want to speculate too much, but do think that the goal is really just to minimize the group, minimize that exposure risk, and encourage everybody to make smart decisions.
Yeah. So you thought it was reasonable considering where we are?
You never want to question the guidance because we're in a tricky position where we needed to do something definitely needed to happen. There's just too much going on out there. And this might be the best route that doesn't entirely cripple the businesses, because taking away indoor dining is one way to very rapidly shut down indoor gatherings. But that's not a smart move. We need to protect our businesses. So again, people order takeout. That's the safest way to do it. Order takeout, take it home, eat it with your family, enjoy it in your pajamas. The most comfortable way.
You don't have to tell me that twice. Okay.
Right.
All right, Ron, who has the next question?
Well, just as a follow-up to that, because there was this question came up, was about, when you're wearing a mask inside of a restaurant. I think there was some confusion on that. Is there any change to that? Or maybe you could elaborate, am I supposed to wear my mask in between bites? Am I supposed to do it in between courses? Do I get up and then I wear it? What are the specifics about that? And has it changed with this most recent order?
Okay, any of our panelists? Mr. Webb?
No, it hasn't changed. It's very simple. It's a common sense thing. You walk into the restaurant with your mask on. You sign the register so that we know you were there. You have your seat. Once you place your order, after you place your order, and it's by being served to you, you can then take your mask off. Enjoy your meal like you would any other time. And then when you want to close out and interact with the waitress again, put your mask on and ask for your bill. And in between, if you need to go to the restroom, put your mask on, go to the restroom, come back. If you have to acknowledge somebody, put your mask on and keep your distance. A lot of people are not doing that.
Chris, let me ask you, is it also safe to say that all these restaurants now have taken the step of having dividers or separators between? Was that a requirement or no?
It's not a requirement. It's been in the guidance that it's allowable. We have had some do it. I don't know that we have a lot. I think a lot of our stores have done it, and wisely so, because that interaction is completely different. Because you do have a lot of time with the customer at the registers during a day. So, if you get more than 15 minutes exposure in a 24-hour period, you're really at risk. So that's really a good use of the plastic in the stores. The restaurants find it, some of them have done some unique things, so it changes the atmosphere. So I give them kudos for that. And maybe some of them will stay and some of them won't, but it's been very interesting to see how people have adapted.
Okay, Kev, roughly how many restaurants do we have throughout the city? A range.
Chris and I had talked about this. It depends on how you count it, like the McDonald's and Burger King count.
Yep.
But I would say we're probably close to 65.
All right, so Chris, a lot of people have asked, now that we've been in this for some time, what are you seeing for violations? Because I think you're now doing spot audits, right? Just popping in unannounced to check in. And of those 65, how many you think haven't been following the rules at any one time?
I would say we let really quickly 2. It wasn't much to remember, and it came down to usually it's the register. That's a big issue. It has to be explained, and we thought we did a good job doing that, but some people just didn't get it. And so from what I understand, a lot of diners are reluctant to do it. And that's another thing that, I spoke about the last time, is that those lists are for contact tracing. And there's 2 places you have to be truthful in this world. One of them is in contact tracing, because if you don't tell the truth, we don't care who the people are. That's never really ever the issue. We want to know how many in their relationships to each other, because they could be moving the disease and we can just follow it. And then if we can do that, we can make it stop.
So
Right.
Chris, I go to Hugh O'Neill's. Is it a requirement that I sign that register? What if I say I'm not going to sign it?
They're not to argue with anybody. You know, that's kind of how we put it. We don't want them to turn off their own customers, but we would like it if they could just give a brief explanation as to why. It might save them if the next guy signs his name.
Now, Chris, I sign it. How long is the restaurant required to hold on to it?
30 days.
30 days. Okay. All right. Very good. Ron, let's see what else we have out there.
Well, actually, you know, I think this is all, I'm going to call this the restaurant show, because Pete Casso out on YouTube has a question about what about small takeout businesses and coffee shops? Are most still doing the takeout, and will, and he has a follow-up question, which we can address after. And he wants to know if we're going to have the parade of holiday traditions this year. So two-parter for you.
So the first part again, Ron?
The first part is whether or not there's going to be an effect on small takeout businesses and coffee shops, you know, with the new regulation.
With the new rules. All right, Kevin.
Other than
So
yep.
Bikini Cafe, let's use them as an example.
It won't impact them. If any, like say, some of the Dunkin' Donuts, I think had later hours, they would be impacted because of the earlier closing. But for the most part, places like that won't be impacted.
So Kev, the 24-hour on Easton Avenue, that Dunkin' Donuts.
That actually hasn't been operating 24 hours because of COVID, but I'm not sure when they're closing. But if they were closing at 11, they now have to close at 9:30.
Gotcha. So same for McDonald's?
It would be the same, but you can do takeout. So you could go in, pick up, and walk out, but you couldn't go in and sit down.
But you could drive around, the drive-through.
Drive-through should be able to stay open.
All right, very good. So I think that takes care of Pete's question. And then the second one was about the parade. We will not be having the parade, right, Chris and Kourtney? You don't see that happening, do you?
I have to say right now, with what we know today, no.
Yeah, okay. Same, Kourtney, on your end?
Yeah, I think we would have to discuss it first, but most likely the data supports not having a parade, unfortunately.
Right.
And I think thinking ahead to different holidays, start to think about what people are going to do for Thanksgiving. And we want to discourage people from traveling out of state and visiting family. If you look around us, Connecticut's a red state now. It's breaking my heart. My family's in Connecticut. You know, we're gonna hunker down. We're gonna stay in this year, and it's just going to be a different way of doing it. So I would encourage people to think ahead. You know, it's going to be heartbreaking, but make those plans now so that you guys are all on the same page and see what we can do to make it special, but in a different way.
Okay, very good. So, Ron, I hate to tell you this, but we're going to have to do another compilation or something, because I forgot that's in 3 or 4 weeks. We lose track of time, you know, but Pete's right. I mean, we should probably issue a notice. We'll have to talk with Chief of Staff to do that. But I think everybody's expecting that will not be taking place. I mean, if we're not doing Veterans Day, I don't see how we do anything else, you know?
Yeah,
So
I think it's worth, and I'm glad that Dr. Nickerson brought up Thanksgiving, because there's going to be a lot of questions on that. I know I have received a lot. But actually what we can do first is we did receive a communication from the state, and it was helpful because they gave us some literature on things that we could share for our own social media. And I'd like to just share one on screen now, and then like maybe the group can comment on you know, on these recommendations. So if you should all be seeing this now, which is tips for a safe Thanksgiving. So I'll just go over it here really quick. On the do's side, do wear a mask, do keep your distance, do wash your hands. And this is interesting. Do improve ventilation by opening doors and windows. On the other side, the don'ts would be don't share food from the same plate or share drinks. Don't shake hands or hug. Don't sing, dance, shout, which increases the chance of catching the airborne virus. And then, of course, don't gather with high-risk individuals such as older adults. So I'd like to maybe just go around the horn here and get the opinion on what we're looking at here.
okay, and before we do, Ron, you plan on sharing this, I presume, leading up
we've got it in the queue to run several times until Thanksgiving.
Okay.
This isn't always, let's just put it this way, in social media land, this isn't always the most popular type of thing to be shared, because this is disrupting one of, a great American tradition. But I think with the experts here on the call, they can help make sense of these things.
All right, Chris, so let me start with you. Do's and don'ts, but what is required? Was there anything in those protocols Monday that came from the state that is a requirement?
Yeah, believe it or not, the governor was pretty strict on this one, and wisely so. I mean, it's very demanding on families, or large families anyway. But the indoor gatherings, private or public, are limited to 10 people.
And of course, that's on the honor system, right? I mean, you don't see people,
Yeah.
going in or scouring homes, right?
I would really caution people not to overdo it, because what's different too in the enforcement section of these last three that came out is the fine is, if you have 10, if you're supposed to have 10 and you have 25, you're going to get 15 fines of $500 for the being 15 people over. So we had inspectors out letting the establishments know that that's the case now too. Anytime you're over a numbered limit, you get the fine of per person is a subsequent fine.
So Chris, that's new.
That is new. Yes.
Yeah, that's really,
It was
Chris,
actually,
does that go for people's homes?
yes, they can be fined. I don't think they have to be, but if you have, like, a lot of people are going to get confused. If we have 11 people in our family and we have 5 more people over, well, is that really that big a deal? Yes. If you have
So
11
Chris,
people,
it doesn't matter if you're related or unrelated.
no, it doesn't. I mean, it has to be occupants of the house. If there's 12 people that live there, that's fine, but you can't invite anybody else.
Okay, very good. All right, who else wants to chime in? Let's go to Dr. Nickerson.
Just to add that there's no activity without risk. We had this conversation about Halloween. We wanted people to enjoy it, but that was an outdoor activity where you could control how much time you were spending around people in that shared airspace, which is where that risk really goes up. And Thanksgiving is indoors. The weather is colder. Even if you have the windows open, there's still shared air, and that becomes much harder to control. And are you going to really want to wear your mask inside with your family? Or stay 6 feet apart, or my family tradition, to sing Christmas carols at the end of a Thanksgiving dinner, because it's that time, and singing, that's producing a large amount of aerosol. So that becomes very hard. So all things to consider, that there's a lot of risk inherent to how we celebrate these holidays, and that's not totally mitigated by all our protective guidelines.
Doctor, do you see the Board of Health going beyond what the state did, or pretty much echoing what they did?
I don't want to speak for the board at this time, since we haven't had a chance to discuss.
Do you have a meeting
I believe we do within the next week or two, right,
Okay.
Chris? In 3 weeks. There we go.
All right, and you can always exceed what the state did in certain circumstances? Okay.
At this time, I think the challenge is maybe a little bit in enforcement. So even with the new mask guidelines and the gathering guidelines, we have a lot of people. We need individuals to step up and take responsibility and know that they're in control of how many people they're inviting over, or their choice to go gather somewhere, and say, I can control whether or not I'm going to open myself up to this risk or contribute to the spread.
Okay.
Unfortunately.
Kev, what are you hearing from the restaurant industry? What are they doing for Thanksgiving? Do you see them staying open, or?
Well, actually, just to move off the restaurants for a second, one of the impacts of the way we'll be celebrating Thanksgiving this year that I've already been hearing about is that because our dining table size will be reduced, the demand for smaller turkeys is higher. So a lot of the larger turkeys are actually going to be in a glut, and the smaller turkeys are going to become more expensive because it's more appropriately sized for the party you'll be having. So my recommendation is just get the big turkey, eat it for a week and a half. You'll be happy regardless. So.
Right. And what are our restaurants doing, Kev? Are they closing? Are they going to try to see if they can play a part this Thanksgiving? Normally they'd be closed, but I wonder, with people maybe doing more takeout, do you see them staying open?
I have not heard from anyone yet. Honestly, it just rolled into Thanksgiving, so we haven't even started talking about it. But I
Yeah.
would imagine that given the very slim margins they've had the whole year, they would not go through the expense of opening for Thanksgiving with the unlikelihood that they'll have a good crowd.
Kev, let's try and get a list together of the ones
do.
that are, and maybe share that with the city at some point,
Great
because
question. Yep.
as Dr. Nickerson was saying, maybe some people will avail themselves of just doing takeout or, something to that effect.
Well, actually,
Sure.
well, don't you mention this? Cornucopia is doing a Thanksgiving meal for one because a lot of people at risk are self-isolating and they're lonely and not getting a meal. So there's a program through Cornucopia, cornufoods.com, where you can order a meal for someone who might be isolating and alone.
Okay, and what's their phone number, Kev?
I can get that to you in the next 2 seconds.
All right, very good. Kourtney, were you going to say something?
I was going to say that it would be great to know which restaurants we're going to be cooking, even a special Thanksgiving meal, because I'm sure a lot of people rely on others to cook their Thanksgiving dinners, as I have never roasted a turkey myself. So we will definitely be looking into alternatives. And so it would be good to know who might be able to kind of fill that gap this year.
I second that, Kourtney.
I will put that
All
list
right.
together, Mr. Mayor, and get it to you. And just to answer your question, Cornucopia is 781-321-3890.
Okay, yeah, let's try and see if, Kev, let's try and get that list up sooner rather than later so people can maybe make plans around it.
Will do.
Okay. All right, back to the studio. So Ron, who do you have next?
Well, before we get to that, I don't know if it was mentioned, but I think there was a specific question about whether or not the airflow. I think Dr. Nickerson may have touched on it a bit. Could you elaborate a bit on where what the logic is behind putting that on the Thanksgiving guidelines? Is it could you make that big of an impact by opening a window if you had at a Thanksgiving celebration?
So there's going to be a lot of variables that are going to affect how much impact an open window would have on getting the air moving. But I think if you've got a good airflow from inside to outside, keep it moving, you could potentially reduce some of that risk of that shared air, which is where the risk of transmission gets higher. So I think we could talk about this more when we think about how like the schools have handled having kids in the classroom and what they've looked at for airflow and how that's been able to be considered as a variable for transmission, because each house is going to be different, each home and each space. But we know that the biggest risk to transmission is aerosols and shared airspace. So when you're in close contact with people, you're breathing the same air, you're producing those viral particles in the air, and that's when you're breathing them in, and you're most susceptible or most infectious. Does that sort of answer your question? This is a tricky one because there's not a one size fits all answer. Chris has got something.
I
Yeah,
just
Chris
have
is got
one
one.
thing to add to that, and it may be common sense, but I'm going to say it anyway. The doctor made a great point about the airflow, and it is helpful, but it's not the only thing that's going to improve the overall day. You've got to, you're going to, I don't know. Most Thanksgivings are pretty boisterous times. There's a lot of close contact, as it should be. What ends up happening is you're expanding your particles all around the room, but they are falling as well. And they are rising and they are falling against surfaces. So whenever you can hit the touch surfaces, wipe down the table. If everybody sits around one table like they did at my house, take a break after an hour or two and clean up the surfaces, get the dishes out of the way, start with some new stuff, use disposable, preferably if you can, without embarrassing yourselves. I know a lot of people wouldn't think to do that, but this year might be the first time that it would be socially acceptable. So I only say these things because my wife and I, our family is not getting together this year. I will save myself at least 3 or 4 pounds in weight gain. So I'm happy with that, but I'm going to miss the food. But we started talking about it, and really it's not if you could be treat it like an emergency room, you could pull it off, but you can't. And you got to keep everything as clean as possible, and having that many people in one space at one time, it's just not practical. It's not safe.
Okay, very good. Back to you, Ron.
Okay, our next question is in regards to talking about the numbers and the limits on gatherings. Sports and sporting events did not seem to really take a huge part in the governor's announcement. It was not really explicitly mentioned about sports, and obviously with winter coming, all sports are indoors by their nature. So have you got any intel on what the future of indoor sports are, specifically the winter sports coming up? I think Thanksgiving is usually the marker, right? Yeah, I saw you mouth hockey. You know where my mind's at. This is, I think the name of this guy that's asking this question is Ron, last initial C. So,
But Chris, sports were indirectly impacted by the lowering of the cap, right?
Yes, yes, they have lowered their numbers. They're going down to 40%. But I think what we have to maybe forewarn people about here is like what the Department of Public Health and the governor have come up with is actions or reactions, let's say, to the current numbers. If the numbers keep climbing, youth sports, I think, will be one of the next things that's truly affected because of the issues they've had with hockey and some of the lacrosse, some of the practices that they've had indoors. They haven't had great experiences with the outdoor sports either. There's been issues there, but manageable. So I think, if the numbers increase, that you may see winter indoor sports go away. And it may be just scaled back a little bit more. Still participate, go to skills and drills only. That's not usually what happens, but it could go baby steps backwards from here on out. And I think people really need to be grateful for what we can do today, follow the guidance, and we'll be able to stay in this phase that much longer.
But Chris, no decision has been made on winter sports.
No, not yet.
Right. But Chris, let me ask you, I thought hockey was under a 2-week hiatus.
They just, I think, finishing up with 2 weeks this week. Yes.
Okay.
But that was a league-wide decision. The governing body made that decision just to see if they could close out and stop the spread, because you couldn't go from, they weren't blaming the individual teams. They were deciding to blame the rinks, not clean enough and things like that. So cover all their bases and start over.
But to you and Dr. Nickerson, I thought come Friday, all sports will be impacted indirectly by the changing of the numbers, no? And if so, what are those? Is it the indoor now, like Kevin was talking about, applies to
Yes.
outdoor? Tell me what happens Friday regarding youth sports.
They're going to reduce their numbers. They've got to go to quarter, if you're using a court, have to use 4 quarters of the court. That it depends on some of the actual sports themselves, but the numbers escape me right now. But I think it's 40. It's only 40% of the. No, that couldn't be it. I'm thinking of something else. Give me 1 second. I'll look it up very quickly.
All right, Kourtney, do you know offhand?
I don't. I tried to pull it up, but I'm having trouble finding it. There's a lot of guidelines right now.
All right, Ron, where's
My
our
apologies.
repository? No worries. Ron, where's our repository if people want to go on and see all the latest changes that the governor announced on Monday?
yeah, so what I would recommend would be to go to the City of Malden's website, which is cityofmalden.org/COVID-19, or if you'd like to go the broader range, which would be mass.gov/COVID-19. And that's where the most recent, you can find pretty much everything there, including the governor's most recent orders. But I'm with you on that question, because I know that 25 was a number, myself coaching hockey, we were able to get in that amount of people because that's about how many 2 teams plus coaches was. But if it's down to 10, that's why I think with this question that I received this question multiple times from colleagues and co-coaches, which is, does this 10 private gathering, include sports? And that's what we're curious.
Okay. All right, while they're looking it up, what else do you have in the queue?
Yeah, so why don't we do this? Let's go to a caller. So we have a caller. Concerned citizen is on the line. Go ahead. You are on the air with the panel. Hello.
Good evening.
Okay, I'm not sure if this is us, but I don't think we can hear the caller. I don't know if the control room can hear the caller. Maybe we'll try to go back to them. No, I don't think so. And that's okay though. And I do have some questions that I do want to get in, so we'll go to those and come back.
Okay.
We just released. Actually, Mr. Mayor, let me ask you this. I know we are planning to show or talk about masks. Would you prefer to do that towards the end of the show, or would you like to jump to that now? Or
It's up to you. Whatever you think's best. I guess we could end with that because it is one of the most important messages each time we're together to promote.
okay, we'll leave a few minutes at the end because we do have a special video to show. Okay, so this is a lot of questions leading up to Halloween. There was a lot of nervousness. And as it turned out, I mean, my own anecdotal stuff, my own observational behavior was that the amount of folks that were trick-or-treating was cut in, I don't even know what the number is, but it's drastic. Maybe we can ask the folks here from health, was it to your satisfaction? Do you feel as though in 2 weeks from now, we are going to see a spike as a result of Halloween, or did we do enough to cut back on what was going on out there?
Start with Dr. Nickerson.
I certainly hope we won't see a spike, because otherwise we made the wrong decision in saying that it was okay. And I would like to trust that everybody try to perform or try to enjoy Halloween as safely as possible. We know that there's some inherent risk with every activity. That being said, I saw some really great creative ways to spread some Halloween candy around, and I've heard good reports of people having very positive interactions with their neighbors. So I would say that I think with limited knowledge that it was a success.
So
But let's get Chris's opinion on that, because I think
I'm gonna go to him in a minute, but let me ask you, I know you were pretty active at that meeting. Looking back, was there anything you would have changed? Anything you would have added or deleted from your recommendations?
I think we took what the CDC had to offer. We took what the state of Massachusetts had to offer, and we said, we think that the people of Malden can use this, and they can do this as safely as possible with these guidelines. So I think we're happy with what we put out there. I think it's an important compromise, because when we think about people's morale, we're going into month eight of this pandemic. Our lives have been turned upside down. So even this little bit of normalcy, and I know it caused a lot of controversy, but this is one of the more safe. No, it's not safe. There's still always a risk with activities, but more safe holidays that we could encourage, just to give everybody a little bit of normalcy going into the winter.
Okay, Mr. Webb? I think you're on mute, Chris.
I agree with Dr. Nickerson. If nothing else, this was the last holiday you could really flex a little bit and not worry about a lot of numbers going up. For one, everybody's outside. They've usually got some kind of face covering, another on anyway. The ones you have to worry about are the parents at the curb. And that's why I was saying, bring your candy to the curb and move everybody along. So I don't know that we'll see a perceptible number. I think Malden's done an incredible job. And I've been saying this from the get-go, and it's not because, I work here. It's a fact. We just have to look at our neighbors who maybe have taken things a little too lightly in some of the leafier suburbs, and not maybe being able to get the communication out in some of the others that really needs to be done yet. But I think overall, it was received well for Halloween. I heard there were no instances or issues with the police, or everybody that did celebrated responsibly, if that's a way, if you can do that. And I hope they had fun, and I hope no one got ill. And I on to the next. We got to put these milestones behind us and take them for what they are, as milestones, because we are still holding well compared to other cities like us.
Okay, and back to you, Dr. Nickerson. I think based on what we heard here in the mayor's office, there were a lot of people looking for guidance from the Board of Health. So if there's an opportunity to do that again for the upcoming holiday season, please do so, because we got quite a few emails and calls about what you think is the best course of action.
We're happy to take all that feedback. Our meetings are always open, so we encourage the public to join us and share their concerns and feedback with us.
All
So
right, very good.
please, the meetings are posted on the city website as well as the agenda. So please reach out. We would love to hear from you.
All right, Dr. Nickerson, do you have the date and time that you could tell the public tonight when that next meeting is?
Not yet, but Chris is working on it right now.
Okay, very good. All right, Ron, what do you have next?
Okay, our next question is about testing. So this came up the other day on a Facebook thread. We were trying to respond for some folks that were really concerned about testing not being available in Malden. You know, my response, of course, was, you know, CVS. It's the typical thing. I'll give the response: CVS, AFC Urgent Care, or mass.gov/stop the spread. My own personal experience was it was super easy to get to these locations. And I personally went to the Madeline English School in Everett, which was right over the border. And I know Square One Mall had one. So, you know, my response on that was, hey, plenty of places in neighboring cities. But then I didn't have a great answer for why Malden doesn't have multiple testing sites. Because I think what got Everett, Revere, and the rest, these sites were, you know, was a spike, was a red declaration. So I think the residents, rightfully so, thought to themselves, hey, we're in the red, where's all our testing sites?
All right, Chris?
Well, I just want to remind people that back in the day when we were yellow, we had a testing site, if you remember, on Canal Street. And we were lucky to get it early in the yellow phase. And we learned a lot from how the testing worked, how long it took test results to come back, and ultimately what we would learn from those tests. The CHA, Cambridge Health Alliance, was kind enough to set that tent up thinking, you know, it's going to go higher. And when it didn't, and we kind of had control and we saw a reasonable infection rate for a city our size, there just wasn't enough demand to have a fully staffed, fully manned pop-up tent. I mean, they commit 4 crews to each tent, and they need business to keep these professionals going and turn the test kits over. Once you expose them, you can lose them. So they're worth their weight in gold. I did reach out to CHA recently, and again, the demand is not here. It's in our neighboring cities. Revere, Everett, Chelsea, Lynn are really, really under a lot of strain. And the hospitals serving them in the next week or two are going to be under a lot of strain.
So Chris, put that into numbers then. I know another way of looking at it. We have been hovering at what, 11, 12 per 100,000. And what is Everett, Lynn, Chelsea, Revere per 100,000 right now?
Revere is at 26.5, I think. Lynn was in the 20s. The Everett was 19.6. Chelsea was 18, I want to say 18.7. And Medford, which isn't much different than us, but they came up to us, which is a concern. And then to the north of us, we have Wakefield that all of a sudden just lit up too. And everybody says, well, what connects us? Route 1, that's what connects us. So I'm looking at that as more of a nexus point. So does this roll back to 930, drop numbers in all of those communities? I think it will. If it doesn't, I'd be shocked. So that's why I love the governor's decision, because it's going to inform us. But yeah, Malden's doing incredible work. I think the schools get a lot of credit too. I mean, they're working remotely and they're still getting the message out. We're getting great feedback at a flu clinic we had last weekend on Halloween. A lot of kids came. We heard a lot of good things from parents. So, you know, while it's difficult to live like we're living, we all have to do it. So, you know, it's next man up kind of thing.
Dr. Nickerson, I guess there aren't a lot of positives, but I guess someone looking at our numbers, you know, we were at 6, then it went to 8, 9, 10. And then it's kind of stayed between 10 and 12. I think it was at 13, but it never did that 10 to 15 to 20 to 25 per 100,000. Is that
And
a
that's
way to
more,
look at it?
yeah, that's a good way to look at it. That's more what we would expect. If we thought it was going to keep rising, we'd sort of see more of a bloom, almost exponential kind of a jump there. But we're doing a great job. We're red, but we're sort of on the low end of the red, which is also positive. So when you look at also where all these testing sites are, they're massively in the red. Chris just read off those numbers, 20% higher. That's really scary to think about. Got to keep our neighbors in our thoughts. So on that side, we are good. I mean, everybody in Malden seems to really be taking this seriously. And the downside is that we've got a lot of people in a small space, and that's just a challenge we have to deal with.
Right. Yeah. Well said. Okay. All right. Ron, what else do we have?
All right, we do have a question. We're going to get to talking about masks in a second, but Rose asks us over Facebook, what is the capacity of hospitals in terms of COVID? So if I guess what she's getting at would be if we're anticipating a surge over, there's been a lot of talk about surge in December. What is hospital capacity like, specifically the ones around Malden?
Before I transition over to Mr. Webb and Dr. Nickerson, in the call on Monday, I think it was, with Governor Baker and the other metro mayors, it was good to hear that the hospitals have not reached capacity. So when one of the mayors asked, wasn't that a factor in raising the alarm, the governor indicated it is prospectively. So you don't want to get there. And by taking these steps now, I think his thinking is it will prevent us from having to exceed the capacity that we have in the hospitals. So, Mr. Webb, are you hearing the same, that we haven't reached capacity? There actually is quite a bit of capacity. They're still doing elective surgeries from what we were told on Monday. Chris, you're on mute.
They have not rolled back any of the elective procedures that they do. They're actually still doing some in-office appointments, but mostly telehealth calls. The capacity for ICU and emergency rooms and beds is probably all in the 90% range right now. And there's a additional 100 or 150 ventilators that came in at the end of the last surge that are in inventory that we didn't have before. That's a considerable amount of ventilators. So we're in good shape. Everybody does their part the best they can, and we avoid anybody going onto a ventilator. I think, we're doing great work.
Okay. Dr. Nickerson, you agree that, are you hearing the same, that hospitals haven't reached their capacity?
To be honest, I haven't looked into it. I think the goal is to prevent them from hitting their capacity, right, because we want to make sure that we can handle the cases of people getting sick from the pandemic, but also the day-to-day, people that are in car accidents, the regular accidents, the regular care that's needed as well. And we don't want to overburden our hospitals because those things are still going to happen too, unfortunately. So we need to make sure that those resources stay available. And when everyone stays vigilant, we're going to be able to keep these numbers down, and maybe we can turn this around and get those numbers lower.
Okay, very good. All right, Mr. Cochran, anything else?
Well, that frees up the queue for now. So I think it's probably a good time, with a few minutes left to go in the show. We'd like to give time for closing comments. But before we do that, let's talk about masks. We have, I don't know if you want to take it from here, or would you like to see our special guest first and then maybe talk about the masks after?
Well, why don't we just hear from Mr. Webb and Dr. Nickerson that after several months of this, you both still believe that this is one way for sure to prevent transmission. Nothing has changed on your end on that, has it, Mr. Webb?
No, nothing. I can't think of an instance yet that's been brought to my attention. I think that there's a lot of people out there trying to do the right thing. I think a lot of people need to look to other people for inspiration sometimes with this. But overall, I think most people are doing pretty good.
All right, Dr. Nickerson.
Absolutely. Wear your masks, please. If you have disposable masks, recycle them after a day of use. If you have a reusable mask, make sure you're washing it frequently. And those little tips will help keep everybody safe.
All right, and Mr. Duffy, you're still hearing the businesses believe in them, right? I'm seeing more and more.
Yeah, the compliance has been great because I think the data's there, everyone's seeing it, and I think everybody is at the point where they want this to be over. So if you said wear the mask on your head as opposed to your mouth, they do that too. So,
Well, I think Hollywood agrees as well because Marvel Studios just announced their newest Avenger, who is going to be making another appearance, fortunately, right here in our city on Friday afternoon. So, Ron, why don't we show Marvel Studios' newest Avenger?
All right, we're gonna let the studio take it away. Well, there you have it. I think, Hollywood has spoken. So I think I'll let you take it from there. Is there anyone that might know who Mask Man is? Has that been discussed at all, or?
Well, if not, we'll find out Friday afternoon, right, Ron? So where is Masked Man going to be?
So Mask Man is going to be in Maplewood Square from 4 to 5 p.m. on Friday, and he will be joined by Counselor Dave Kamel.
And we'll be handing out what will be given.
So we are going to be, Mask Man will be handing out Malden themed masks. So these are the reusable cloth-based masks that have the City of Malden logo on the front of them. Have been very popular now. Got a lot of folks that have taken up. But, how can you refuse when a superhero is offering it to you?
All right, very good. So that's Friday, November 6th from 4 to 5 p.m. Maplewood Square.
Correct.
Okay, very good. All right, let's close it out then. Let's start with Mr. Duffy. Any final thoughts?
yes, sir. Just to follow up on something earlier, in the last few minutes, I was able to cast as wide a net as I could. I reached out to 21 of our restaurants. I got 17 responses. There will be 3 restaurants open on Thanksgiving, one of which is the Doo-Wop, so they'll be closing at 11:30. But District Kitchen will be open and Faux Bistro. All of the others, it's traditionally one of their days off, so they won't be open on that day.
All right, again, Kev, let's get that out at some point. That'll be helpful for people.
We'll do, and I'll follow up with the rest of the restaurants as well. As far as closing thoughts, we have a great stretch of good weather coming up, at least maybe 5 days, a couple of them hitting 70 degrees. This is a perfect time to get out, enjoy the outdoor dining for the last of 2020, and support your favorites.
All right, well said. Dr. Nickerson.
Thank you, Mayor. Thank you, Malden. Please keep up the good work, everybody. Go get tested, wear your masks, wash your hands, clean your surfaces, and keep trying. We're doing great. We're one day at a time. That's all we can do.
Very good. And Mr. Webb.
I just want to say, I'm always impressed by the production values of this show. It's gone up dramatically from day one. I feel more comfortable, and I know that people in the community are enjoying it as well. But that said, I think that it would be incumbent upon me to remind people, just hang in there. It's like a long blizzard is how I'm looking at it. And if you can, everybody's going to slip up once in a while. We all do. Just recover, stay on the basics, wear your mask, wash your hands, clean your surfaces, and keep your distance from people you don't know. And even that people that you haven't been around day in and day out, they could be a carrier, and that's where we're slipping up most. So be well, enjoy the holiday, And I'm sure we'll have some more guidance for you on that as in a week or so, I would think. And we've got to get a time for the board to meet.
All right, very good. On behalf of Ron Cochran, our communications director, and everyone at Malden Access Television, thank you for tuning in. And as was mentioned, unfortunately, this is a marathon, not a sprint. So do your best, hang in there. Let's work together. We're Malden. We'll get through it.